Difference between type 1 and type 2 diabetes mellitus. First is pathology. In type 1 diabetes, which is an autoimmune disease, there is a destruction of pancreatic beta cells which are normally responsible for production of insulin, but now due to destruction there is no production of insulin. That's why insulin level is low, and due to that type 1 is also called insulin-dependent diabetes. In type 2 there is a insulin resistance which is almost always associated with obesity. That's why there is normal or increased level of insulin. That's why also known as insulin-independent diabetes. Autoantibodies and HLA association. Type 1 shows anti-GAD and anti-ICA512 antibodies and HLA-DR, 3 or 4 association, whereas type 2 is not associated with that features. Genes and genetic inheritance. Type 1 is associated with mutation in CTLA4 and PTPN22 with 50% genetic inheritance, whereas type 2 is associated with genetic mutation of TCF7L2, PPARG and FTO with 90% chances of inheritance. Age and histology. Type 1 usually affects youngers and shows insulitis, whereas type 2 usually affects adults and shows amyloid deposition. Complications. Type 1 is associated with diabetic ketoacidosis and type 2 is associated with hyperglycemic hyperosmolar coma.